Peripheral neuropathy refers to damage to your peripheral nerves. It can be caused by different diseases or injury. The main parts of your nervous system include the central nervous system, or CNS, made up of your brain and spinal cord, and the peripheral nervous system, or PNS, made up of a special class of 12 paired nerves that branch off of your brain and brain stem, called cranial nerves, to supply areas of your head, face, and neck, and paired spinal nerves that branch off your spinal cord to supply the rest of your body. Your peripheral nerves, including your cranial nerves, carry signals or impulses to and from your brain and spinal cord. There are 3 types of peripheral nerves. Motor nerves make your muscles move. Sensory nerves detect light, sound, smells, taste, and touch, and carry those signals to your brain. And autonomic nerves regulate activities you don't consciously control, such as your heart rate, breathing, and digestion. The main type of cell in your nerves is called a neuron. It has 3 basic parts: a cell body, or soma, 1 or more dendrites that receive signals from other neurons, and only 1 axon that carries signals away from the cell body to other neurons. The cell bodies of peripheral neurons are found in your spinal cord and in small structures near your spinal cord called ganglia. Your peripheral nerves contain bundles of nerve fibers made up of long axons and dendrites. They carry signals between your central nervous system and your body. If you have peripheral neuropathy, you may have 1 or more conditions that damage your nerve fibers, which can disrupt this critical link between your CNS and your body. One form of peripheral neuropathy is called mononeuropathy. It means you have damage to a single nerve. The most common mononeuropathy is carpal tunnel syndrome. It's a condition that compresses the median nerve in your wrist. Another form of peripheral neuropathy is called polyneuropathy. It's more common than mononeuropathy and can involve many nerves in different areas of your body. The main risk for peripheral neuropathy is type 2 diabetes. If your blood sugar is too high for too long, it can damage your nerves. Other risks include alcoholism, blood vessel or blood flow problems, high blood pressure, infections, certain medications, toxins such as lead or mercury, physical injury and trauma, inherited peripheral neuropathy diseases, and autoimmune diseases where your immune system attacks your body by mistake. The symptoms of peripheral neuropathy vary depending on the type of nerves affected. For example, damage to your sensory nerves can cause tingling and numbness in your hands and feet, and pain that you feel more easily or intensely. Damage to your motor nerves can cause muscle shrinking, also known as atrophy, muscle weakness, cramps, uncontrolled movements, and balance problems. Signs of autonomic nerve damage include intolerance to heat, sweating too much or too little, and bowel and bladder problems. Left untreated, peripheral neuropathy can cause a range of complications. In diabetes, poor foot circulation and numbness can lead to ulcers, infection, and amputation or surgical removal of your foot. And muscle atrophy and balance problems may increase your risk of falling and breaking a bone. Treatment for peripheral neuropathy is based on what's causing it, if known. The goal is to reduce your symptoms. For example, if you have diabetes, you will need to keep your blood sugar as close to your target range as possible. This will help prevent or slow the progress of nerve damage. You may need to use a medical device, such as a brace, cane, or walker, to help improve movement and prevent complications. For pain, your healthcare practitioner may have you take over-the-counter pain medicine or prescribed pain medicine. Some prescribed pain medicines may also treat depression. If you have a trapped nerve, you may need surgery to release the pressure on it. There are things you can do to help prevent or delay damage to your nerves. If you have diabetes, keep your blood sugar as close to your target range as possible. Eat a balanced diet. Maintain a healthy weight. Avoid drinking alcohol. And don't smoke. Get regular physical activity. And take any medicines exactly as your healthcare practitioner prescribed. To find out more about peripheral neuropathy, talk to your healthcare practitioner.